hospitals are facing. Dr. Adrian Boyle is from Cambridge, took over as president of the Royal College of Emergency Medicine in October. Good morning, Adrian.
Good morning.
If you can try and sum up the situation facing emergency medicine as we go into winter.
So it's very tough at the moment, both for patients and also for staff who are looking after them. We find that it's very frustrating and very wearing trying to look after our patients properly. And it's because we just don't have the flow through the hospitals. So patients are waiting a long time. It's really difficult to get to them and look after them in the way that we would want to. So we constantly go into hear stories about people waiting a long time in an ambulance. They're waiting a long time for an ambulance to get to them. They're waiting outside the hospital for a long time. Then when they get in, they're having a long wait. And if we decide they need to be admitted into hospital, they can regularly get waits of over 24 hours to be admitted into hospital. And this shouldn't be a complicated thing to do. If someone has a health emergency, what we want is for an ambulance to be able to get to them within a short period of time, certainly less than half an hour. When they get to hospital, be promptly handed over to expert medical staff who can see quickly, deal with, support, find out what's wrong with them, and then pass them on to their relevant department. And they should all be admitted within about 6 hours of that initial call. And that's just not happening at the moment.
I suppose one of the challenges, Adrian, with trying to make any kind of change within the NHS or within any kind of healthcare system is that you have to make changes at the same time as providing a really important and life-changing service. And trying to do those two things at the same time, inevitably, that's going to be really tough. What changes might actually help and might help get things onto a more even keel?
Well, it's important to remember that this is actually a relatively new problem. I know there have always been winter stories about A&E crises, but if you go back only 7 years, we were having nothing like the problems we're seeing with ambulance offloads. And actually what's happened this year has happened much worse, much more quickly. So I really don't buy the argument that this is too difficult to fix. It really is actually very fixable. And if you go back over my career, we've been in positions where it's been very fixable. And as to change, we've dealt with change a lot while things have been going on. If you looked at what we did during the early stages of the pandemic, most of us rapidly reconfigured our services very, very quickly. So I would push back against the despair narrative. This is fixable, and we regularly fix things as we're going along. But we need support to try and do these changes.
I love to reject the despair narrative, Adrian. This is great news. What would work? How can we fix this?
So it's going to come down to money, and actually where the money needs to be spent is actually on the back door of the hospital. The hospital needs to be able to discharge its patients. Now, if we look at what's going on across England at the moment, people don't want to work in social care because their salary, it's tough work. It's often not really valued very much by society, and they can get more money going to work in the supermarket or working for Amazon. So we need to start finding some way that we can pay people who work in social care more so we can use our hospitals better. That's easily the first, quickest, most cost-effective thing that we could do. Alongside that, we do need to start expanding the bed base of our hospitals. The UK has almost one of the smallest bed bases per head of population of any European country. And this is one of the big problems that we've got now. And that's why, the pips are squeaking so much.
OK, so focus on changes to social care, get people out of hospital more easily and more beds in hospital. Adrian, thank you very much for those suggestions, those possible solutions. Any ideas that you have, very eager to hear from you. 08000 85 95 96. That's Dr. Adrian Boyle. He's from Cambridge, just recently taken over as the president of the Royal College of Emergency Medicine, talking about the challenges facing the NHS as we run into winter and potential solutions to make things easier.